Good morning, everybody. I'm Bob Sanborn, President and CEO of Children at Risk. We're excited to have you here today. We're talking about back to school, masking, and race equity in our state of Texas. With me, a great panel today. First off, Sharon Jones is with us. Sharon is the head of the Texas Racial Equity Collaborative and also part of the team at Children at Risk. Thank you, Sharon, for putting all this together. Also with us today is Evelyn Malone Hicks. Evelyn is a registered nurse, an MHA nurse, a healthcare consultant, but more importantly, she's the parent of elementary school children, Lamar Consolidated ISD, giving us a little bit of that nurse and parenting point of view. Evelyn, thank you so much for being with us today. Also with us today, Elijah Barefield. He's the Dean of Students out of Carver Middle School, Waco ISD. Thank you, Elijah, very much for being with us. And last but certainly not least, Dr. Jasmine Jenkins, who's the Executive Director, Houstonians for Great Public Schools. Jasmine, thank you very much for being with us today. It is back to school, and frankly, for a lot of our children, almost all of our children, it hasn't been easy to go back to school. It's clear that because of COVID, some of our children, some of our families have suffered more than others. It's lack of internet access, falling behind in school, the impact on the income of our families. All of our children, certainly those from low-income families, and especially Latino and African-American kids, have been greatly affected. These communities have suffered higher rates of COVID, higher rates of death because of COVID, and it's affected these kids psychologically and in their studies. We're looking, as we look at sort of how far behind of our kids, we've done so much research on how summer has impacted our kids, but we know that for children of color, we're expecting 6 to 12 months of learning loss or more. When we're talking about white students, it's 5 days. So there's certainly a difference when we look at affluence and non-affluence. When we look at race and equity, certainly there's a big impact there. And then when we look at, because of all this, when we look at masking policies or anti-masking policies, there seems to be a significant impact on children of color. When a child's world has been turned upside down because of COVID, whether it's because of not going to school or this loss of income, illness, or death of a family member, the last thing they need is politically influenced health or anti-health policies that they might feel are aimed at their families, risking the health of these very same families. School leaders across our state, in most cases, are doing their darndest to make sure that our children can stay safe. But let's let them keep those kids safe and reduce the anguish and anxiety that these kids feel when they become these political footballs because of masking policies. All we're asking is sort of let our leaders who really care about the health of our kids do their job and reinforce that we want our school leaders to care about this. 1 in 10 children in America is born here in the state of Texas. 60% of our school kids are low-income kids in our state. And that the majority of our kids in the state of Texas are children of color. The majority of our kids in the state of Texas have been really impacted by COVID. And so what we're saying is that we want to keep our kids safe, and we want them to do what our pediatricians and what our school nurses are saying that they need to do. Just keep those kids safe in whatever way possible. And I think this is the important thing that we're all here to say is that we're seeing this with a race equity lens, and it's impacting our children in the state of Texas. But for us, it's not a political issue. For us, it's a keep our kids safe and let them stay on this road to success. That's the key and essential item here for us, is that we want to make sure that our kids can grow up and be everything that they want to be. COVID has set us behind, but we need to get back on track. Sharon Jones, maybe you could add a little bit to this. Sharon Jones is the director of our Texas Racial Equity Collaborative and at Children at Risk. Sharon?
Thank you so much, Dr. Bob. Masking and other related health and safety measures have truly become an equity issue for children of color. Not only are these families disproportionately impacted by COVID-19, but there are ripple effects for their daily lives. We're seeing pandemic learning losses and widening technological gaps. Additionally, lack of masking policies can expose our younger unvaccinated kids to a disease that they could take home to other vulnerable family members. causes missed work, lost wages, and hurdles for people to adequately prepare for their families and keep them safe. And so I'm really pleased to sort of kick this conversation off with Nurse Evelyn Malone Hicks. And we'd love for you, Evelyn, to share with us your thoughts and your expertise on masking as a back to school concern, and tell us what we need to know to protect our kids at school.
Certainly. Thank you, Dr. Bob, and thank you, Sharon and Children at Risk, and the great work that you're doing. So I'm Evelyn Malone Hicks. I'm a registered nurse. I've been in practice for over 30 years. And this is a global pandemic. So what I'd like to share with you first are just some simple statistics we've all heard, we all know. Now everybody's a COVID expert, right? You know, our real-time data is so fast, but unfortunately, misinformation comes out faster than the truth. But let's set the record straight. The American Academy of Pediatrics has already stated that we have about 27% of the cases in the United States are children. So that's very significant. For the 5th week in a row, the American Academy of Pediatrics has also stated over 200,000 new cases of COVID occur in children. So it is definitely not just the society's situation to try to protect our children and help the parents and the teachers, but everyone has a part of this. Our children are immunologically underdeveloped. So what does that mean? They're vulnerable because they're at risk, because their immune systems are still developing. So it's important that our school-age children, K through 12, are protected with regards to this respiratory invisible pandemic. When it comes to masking, I live in a district of Lamar Consolidated ISD, and there's not a mandatory mandate, but our parents are making their decisions and the children are making their decisions based on their individual situations. Now, the CDC tells us that regardless of vaccination status, all children should mask up. So that's very important. From a nursing standpoint, I'd like to bring up the types of masks that are important. You have your cloth mask, and you have respirator level mask, and you have disposable mask. No, it is not easy. I have a 9-year-old and a 10-year-old in the 4th and 5th grade. Do you think they want to wear a mask? Absolutely not. But in an indoor public situation, the CDC is clear. The data is clear. We know that masking protects us. How? First of all, it stops the particles from respiration from the person wearing the mask getting out. So that's important. And kids have all sorts of things. Here we are going into flu season. We have a change of seasons. Even here in Texas, we have fall. So pollen and other things are there. So many of the symptoms that you would be used to hearing about for the flu also mimic COVID-19 and also mimic allergies. So you really don't know what's out there. In addition to these masks, it also has a barrier protection from other respiratory particles coming in from other people. So that's very important. You can double mask, wear one of the disposable kind of medical masks that we see out there, and perhaps put a cloth mask over it. And it's so important that if you are a parent and you're sending your child to school with masks, have extra, because what you don't want is a soiled or a wet or a dirty mask to stay on that child all day long. My kids have different masks. They love switching them out with their outfits and their colors. And Lamar Consolidated has actually allowed parents to ask for extra protection if needed in the classroom by putting a plexiglass around the area. There's no way to social distance in some of these classrooms. So it's important that we do allow for protection of our teachers and our parents. I'll end on the note really echoing what Ms. Jones said, which is, in our minority communities, we tend to have multi-generational families. So this is not the traditional nuclear family. Our children aren't going home just to mama and daddy. They're going home to big mama, to pawpaw, and to other aunts and uncles who may be living in that home. So this multi-generational situation, and our children who are carriers of this COVID-19 situation cannot just infect their parents and the teachers, but we also have vulnerable elderly at home that we need to protect. So thank you for allowing me to share those statistics with you.
Thank you so much. And it's one thing to know the facts and to know what it is we need to do, but it's another thing to put it in practice. And so I want to pivot and talk to Elijah Barefield, who's Dean of Students at a middle school. We know middle school children can be resistant to taking care of themselves in the way that they should rather. And so I'd like to know what that looks like in practice, keeping children safe, and what are you seeing on the campus level that works?
Good morning, Dr. Sanborn, Ms. Jones, and children at risk. I'd like to echo Ms. Malone Hicks's comments. Thank you for having us on here. As you said, middle school, the fun years. Fortunately, I do work in a district here in Waco ISD where we do have a mask mandate. It is mandated here. And so what we have found is that surprisingly, the kids don't have a problem wearing masks. Now, they may want to try to walk through the halls with them hanging down beneath their nose or up under their chin, and we always have to remind them to cover up. But for the most part, the kids are doing well. Our biggest issue is that we have to pass out a lot of masks daily because the children don't come to school. They get off the bus without a mask. They've even got to the point now that where we're providing masks on the buses. And so what we try to do is we try to focus on the things here that we can control and influence. And so as Dr. Sanborn was talking about the learning loss, for that, we have after school program, our ACE program. Our kids go in there, they get to do fun activities, but they also get to make up for time with learning. We have teachers who volunteer to provide extra tutorials. For the relationship part, we offer social emotional learning classes during the day. It's part of a curriculum. We call it PAUSE here at our school, and different schools call it different things, but it's about teaching children how to manage the stress and some of the uncertainty of dealing with COVID, because we have students here who have lost family members. The sad thing about at GW Carver, the first person to pass in McLennan County last year from COVID-19 was the principal of GW Carver. And so it has hit us very, very hard, and it's very personal. And for that reason, we also have extra counselors. We have our community and schools program who provides mentors to the students. They provide clothes if students are lacking on clothes. We have family support specialists who will go out and meet any need that a parent has. If a parent is having difficulty paying a light bill, our family support specialists try to find resources. If they're having problems getting enough food in the house, they try to garner resources for that. We work very closely with the housing authority to try to make sure that when our students come here to school, they can focus on learning. And speaking of learning, one of our mottos this year is that we're trying to accelerate and not remediate. As Dr. Sanborn talked about the learning loss, that 8 to 12 months is serious. That's an entire year. And so what we try to teach our teachers is not to get caught up with trying to catch up or go back to where the students left off. We have to teach them on the grade level that they're in now, but also spiral back to catch up those skills that they may have been lacking. Otherwise, we'll always be playing catch up and we'll never get ahead of this.
Thank you so much. Dr. Jenkins, let's now talk a little bit about policy and recommendations from your perspective as Executive Director of Houstonians for Great Public Schools. What's your view of masking policies and mandates, and how we can protect our kids and recoup the losses that were taken from them by COVID-19?
Well, first, thank you so much to you and to Dr. Sanborn for putting this event together. I think that it's an incredibly timely topic. Even though the school year is well underway throughout the state, we still have conversations about how kids can stay in school safely in person. I think that what the steps that a lot of big city and even smaller school district superintendents and school boards have done in terms of implementing mask mandates have been in the best interest of the biggest number of students. You guys have highlighted the inequities that currently exist and the fact that the only way we're going to make up these gaps is to make sure that kids are in an environment where they feel safe, where they can learn. And I think that superintendents should be commended for standing up against the governor and the state legislatures ruling against mask mandates and doing what was best in the local context. Unfortunately, at this point in time, in Houston ISD, the largest school district in the state of Texas, is in the midst of a school board election season where this issue still comes up. It's very much become political. And while I think a lot of administrators and even those who are in elected positions feel like they did what they could to make sure that kids could return to school and return to school safely, that we could continue in-person schooling with the mask mandates. This is still sort of a political hot potato. And right now the superintendents are dealing with the repercussions at the state level, trying to ensure that they don't lose funding. However, the overwhelming amount of evidence shows us that kids are going to do better when they're in the classroom, and the safest way they can do that right now is just making sure that everybody is masked up.
Thank you so much. I do have a follow-up question for Dr. Jenkins, and it's about the technological divide. And we know that 1 in 6 public students in Texas lacks access to high-speed internet, and 30% of them don't have a dedicated or adequate learning device, such as a laptop or a tablet computer. And so for kids of color, when they are not safe or when they do contract COVID-19 and have to quarantine, it's kind of a snowball of having to go home, missing lessons, and all that comes with it. And the technological divide is a big factor of that. What are your thoughts on that?
That's a really great question, because a snowball effect is a perfect example, right? We've got kids who may themselves be experiencing illness, and so that's one setback. Then they may have family members who have passed away, who've been in the hospital. So we've got the trauma of that experience. Then we've got them out of a social context with their peers. And after we get all of those physical and emotional barriers, then we have to talk about how they're going to learn, right? And so all of these issues compiled together are incredibly difficult. And these are the questions that teachers and administrators are facing. One of the things that, again, addresses one small piece directly to your question that was done in Houston ISD in the beginning of the 2020-2021 school year, so this was back in September and October of 2020, was the interim superintendent at the time ensured that there were enough laptop computers and hotspots for every single student to be able to take home. That was a really broad sort of like blanket attack at addressing some of these inequities in technology. But what I'm hoping we see moving forward is sort of refining that, because the truth is there are some kids in a school district this large who already have access, right? So how can we best use the resources we have? How are we empowering school principals who know their school communities and their children the most to say, okay, look, half of my kids actually don't need laptops, but the other half of them need a laptop and a hotspot and maybe some sort of a smartphone device, so that we can better utilize the resources. We really need to make sure that our school leaders are empowered in that way.
Very good. Sharon, if it's okay, I'm going to do a few words. I know that we have some Spanish media on board today. Una palabra para la prensa latina. But Sharon, you're going to speak some Spanish as well, is that correct?
Sure.
Okay. No. Mira, lo que queremos nosotros es un buen salud para nuestros niños. Y ahora tenemos reglas en nuestro estado contra la salud. Y lo que queremos es que nuestros directores, los líderes en nuestros distritos escolares, ellos tienen la habilidad de usar la cubreboca, policías sobre reglas sobre cubreboca para proteger nuestros niños. Cada área del estado es un poco diferente, pero lo que sabemos es que familias quieren este buen salud para los niños y no quieren mandar sus niños a una escuela donde no hay donde hay la posibilidad que van a enfermar. Así que nosotros queremos que todos puedan hacer lo que tienen que hacer para la salud buena de nuestros niños. Y la otra cosa es que no queremos que esta sea una cosa política lo que importante es el éxito de niños, no el éxito de nuestros políticos. Es la cosa más importante para nosotros. Sharon, one or two more questions maybe for our group before we finish up today.
Yes. So another thing that we know is a concern are the rates of anxiety and depression. And for African-American and Latino children, those rates have been rising over the years, and the upward trend has continued due to COVID-19 because the pandemic has limited social activities. You know, children have experienced loss. And I know, Elijah Barefield, you addressed that a little bit. Let's talk a little bit more about how your school is addressing mental health needs. I know you had a particular incident at the beginning of the school that has exacerbated those needs.
Yes, ma'am. Thank you. On July 27th, our building, GW Carver, burnt down. And so we have had to combine with a school across the river, Indian Springs. So now we're all up under one building. And with that has come its share of difficulties because our students have been dealing with trauma for so long. And with the answers that they give us, the questions that they ask us, they're always asking, are we going to come back? Are we going to be there? They haven't had a principal for more than a year in the last 4 years. So it's constant change, constant turmoil. And then you add along the pandemic, these babies, they've been through quite a bit. And so what we do is we offer mentoring. We have a check-in and check-out program where we check in on our students at the beginning of the day. They're assigned a mentor that will make sure that they keep a personal relationship with them. And that kind of goes into my job as a dean of students. My job is to help build relationships and work with students to manage the stress of the environment outside of school and any issues that they may have in school. Because one thing we try to teach them is that when you come to the school, you're safe. And we have to try to provide that type of environment for them. So what we have found is that them having a trusted adult that they can talk to has helped ease a lot of them. And they're a little bit more excited about coming back to school, and that makes us feel a lot better.
I think the bottom line there for all the things that we've talked about is making sure that students are safe and making sure that they understand and feel that they're safe. So I guess to wrap up, I'd like for Nurse Evelyn Malone Hicks to sort of give us some final thoughts on masking and what parents need to know for their children's safety.
Certainly, thank you so much. First of all, I want to be clear that our children's facial structure and size is different from those of us as adults. And I'm really specifically referring to those children ages 5 through 11 who are not yet eligible to even be vaccinated. We know the number one defense that we have against COVID-19 is vaccination. Unfortunately, that sector of our population isn't eligible. So with that, I would just encourage parents as they're ordering their mask from Amazon or from any other company to be clear on the sizing. See if it's a child level mask. Now, I'm sure there are some children who may need or could wear an adult size mask, and that's fine. A couple of the key components will be making sure that it's covering both the nose and the mouth. So again, what a Principal Barefield was talking about, you see them hanging off the chin and going through the hallways. That's so easily done. And even as an adult and as a nurse, I'm guilty of that when I'm, in certain areas. But it's very clear in indoor areas and in public places, in order to stop those particles from reaching our respiratory system, we need to cover all of those open areas. So the nose and the mouth. So it's very important that that mask has that nose bridge. And many of you may understand what I'm speaking of. When you see the mask and you feel it, you're like, is it upside down? Is it the right side up? You'll feel the metal guard or some moldable piece within the mask. So that's very important.
Evelyn, I will be surprised, Evelyn, if after this, you're not picked up by some TV station to be their on-air
No.
This is very, I want to finish with another question if I can, Sharon, for Jasmine, because I think this is really important, is that we know that there are a lot of kids, a lot of families basically, that have held their kids back because they're seriously worried about their kids getting sick, or more importantly, their kids coming back and getting grandma, grandpa sick, or other members of the family. And the negative impact on those kids by missing out on school. And we know that the parents do their darndest to keep the kids up to speed. Even when they have internet access, we know these kids are falling significantly behind. How serious is it for this majority of our kids in our state when families are holding them out? And we understand why they are, but when the state refuses to sort of have pro-health policies, how negative it is for these families and these kids?
I mean, the impact is, goodness, I can't even say it's doubled, right? It's compiled, because not only do we then have, families who are worried, they're keeping their kids home, the gaps widen, right? The kids are don't have access to that high quality teaching and high quality instruction. But on top of that, the funding model is based on student attendance. And so, and of course, there were special dispensations last year, but as we continue, the longer parents keep kids out of school, the more they find other avenues or the less relevant they see it. We've got declining enrollment across the state, and then you've got school districts struggling to educate the kids who are still there because of the funding issues that they have. So Dr. Bob, I think you're right on in pointing out the fact that if we don't have a way for kids to be at school safely, for parents to feel comfortable sending their kids to school, then we're just going to continue compiling the problem and the inequities will increase.
Yeah, very good. Thank you, Jasmine, so much. Sharon, any final thoughts before we end up?
I just want to thank everyone for joining us for our first Racial Equity Rapid Roundtable for the Children at Risk Texas Racial Equity Collaborative. And we'll host these monthly quick Q&A sessions to examine topics of racial equity with other experts on children and families. So thank you so much.
Very good. Thank you, Sharon. Thank you, everybody. Take care. Bye-bye.